There's a hidden truth your doctor might never tell you. Every year, millions of seniors line up for health checkups, believing they're protecting themselves. They sit in sterile clinics, roll up their sleeves, and say yes to every test, every scan, every machine that hums and glows, because that's what we've been taught. Early detection saves lives, they say. But what if, after 70, that very belief starts turning against you? What if those routine checkups, the ones meant to keep you safe, are quietly shaving years off your life? According to a study by PubMed Central, it has uncovered something terrifying. Up to 30% of medical tests performed on seniors lead to unnecessary treatments, complications, or lifelong side effects. And yet, 99% of people over 70 have no idea it's happening. One of these tests, just one, is responsible for up to 5% of all cancer cases in the United States. That's the same number caused by drinking alcohol every single day. The system isn't broken by accident. It's over-testing by design. And if you're over 70, you might already be caught in it. So, in this series, we're exposing the 5 checkups you should avoid after 70. Tests that could harm you more than they help. All backed by real science and the stories of real people who paid the price for trusting too much. Let's start with number 5, the test that seems harmless but can quietly ruin your quality of life, the bone density scan. It's quick, it's painless. You lie on a table, the machine passes over you, and in a few minutes you get your results. It's called a DEXA scan, and it measures how strong your bones are. On paper, it's smart preventive medicine, but for older adults, especially women over 70, this test can lead you down a dangerous road, because after that age, the results almost always show low bone density, even when there's no real danger. That's not a diagnosis, that's aging. Bone loss is as natural as wrinkles or gray hair. But here's where things turn dark. Those low results scare people. Doctors prescribe powerful bone medications called bisphosphonates, drugs that promise stronger bones but can come with devastating side effects, inflammation of the esophagus, digestive problems, and a rare but horrifying condition called jaw necrosis, where the jawbone literally begins to die. Let me tell you about Rose, a 76-year-old retired piano teacher. She had never fallen, never broken a bone, walked every morning. Her doctor ordered a DEXA scan just to check. The result, osteopenia, a mild reduction in bone density that doesn't even qualify as osteoporosis. But fear took over. She was prescribed a bisphosphonate immediately. Within 3 months, she developed severe reflux and jaw pain. The medication that was supposed to protect her almost silenced her passion. She couldn't play piano anymore. When she came to us, she was scared and exhausted. We stopped the medication and focused on what actually works: vitamin D, resistance training, and calcium-rich foods like sardines and leafy greens. 1 year later, she was performing again, stronger, steadier, and completely drug-free. The truth is clear. For most people over 70, a bone density scan doesn't prevent fractures. A massive study in the Journal of the American Geriatric Society found that these drugs reduced fracture risk by only 0.3% after 5 years. But the side effects? They were far more common. A short scan might sound harmless, but fear sells. And for seniors, fear means prescriptions. The better medicine, the real prevention, is movement, balance, sunlight, and food. You don't need a scan to tell you that, but if that test is dangerous, the next one is worse. Because it doesn't just cause anxiety, it can lead to unnecessary brain surgery. Number 4, the brain MRI. When seniors start forgetting things, a name, an appointment, where they left their keys, panic sets in. Is it Alzheimer's? Is it dementia? So the doctor orders a brain MRI. You lie in a loud claustrophobic tunnel, hoping for answers. But most of the time, that scan gives you something far more dangerous than disease. It gives you fear. MRI machines are incredibly sensitive. They can detect microscopic age-related changes, tiny white spots, slight shrinkage, things that are completely normal after 70. But when those images land on a doctor's screen, the conversation changes. We found something. 3 words that can destroy peace of mind overnight. In a 2021 study published in Neurology Today, over 3,000 brain MRIs were reviewed in adults aged 70 to 85 who complained of mild forgetfulness. 86% showed abnormalities, but only 3% were actually treatable. That means 97% of people went home believing something was wrong when nothing truly was. George was one of them. A 74-year-old retired engineer, sharp and independent. He misplaced his keys more often, forgot names now and then. His doctor ordered an MRI just in case. The scan showed white matter spots, completely normal for his age. But George didn't know that. He spiraled into panic, stopped driving, stopped going to church, convinced he had dementia. Months later, when we tested him with a simple cognitive screening exam, he passed easily. His brain was fine. His fear, however, wasn't. It had stolen 6 months of his life. Here's the truth most clinics won't say. For mild memory loss, a brain MRI is rarely helpful. Unless you're showing red flag symptoms, sudden confusion, seizures, or rapid decline, it won't change treatment. But it can change how you see yourself. It can make a healthy person feel broken. A better, safer first step is a cognitive screening test, a paper-based exam that checks memory, attention, and problem solving. It's simple, inexpensive, and tells you far more about your mind than a scan ever could. So if you or someone you love is over 70 and thinking about an MRI, just to be sure, pause. Ask this question: what happens if the scan finds something? If the answer is more tests, more procedures, or we're not sure yet, that's not clarity, that's a trap. These first 2 checkups, the bone density scan and the brain MRI, are perfect examples of medicine gone too far. Tests that look helpful, but feed fear, drain hope, and create patience out of healthy people. But as shocking as they are, the next 2 may make you rethink everything you thought you knew about heart and colon health. Because one leads thousands of seniors straight to unnecessary surgery, and the other, the one almost everyone over 70 has done, carries a 10-to-1 risk-to-benefit ratio. You've seen how a simple scan can steal peace of mind. But what happens when a test doesn't just scare you? It sends you straight to the operating table? The next 2 checkups on our list are among the most common in seniors, yet they're quietly driving some of the most unnecessary procedures in modern medicine. And the worst part? It all starts with a good intention. A doctor just trying to be cautious. But just to be sure can become the most dangerous phrase in healthcare. Number 3, the cardiac stress test. It sounds logical. You're feeling more tired lately, maybe short of breath walking up a hill, so your doctor wants to check your heart. You step on a treadmill, wires are attached to your chest, and a monitor watches every heartbeat. The goal? To see if your arteries are blocked. But here's the disturbing truth. In people over 70, this test often tells a story that isn't true. A 70-year-old heart doesn't behave like a 40-year-old one. It beats slower, the arteries are stiffer, and the electrical signals change with age. That means stress tests, which look for abnormal patterns, often flag problems that don't exist. Studies show that up to 40% of stress tests in seniors produce false positives, results that suggest danger when there isn't any. And that's when the spiral begins. A positive stress test leads to a referral for an angiogram, a catheter inserted into your arteries to look for blockages. If the doctor finds even a mild narrowing, a stent is often placed immediately. You wake up thinking you just prevented a heart attack. But in reality, many of those stents never needed to be there. In 2017, a major JAMA cardiology study revealed that more than half of all stents placed after stress test referrals were done in patients who had no clear symptoms. and no real benefit. Their survival rate didn't improve. Their quality of life didn't improve. What did increase, however, were complications. Bleeding, kidney injury from contrast dye, and weeks of recovery that never should have happened. Take Raymond, a 75-year-old retired postman who loved his morning walks. During a checkup, he mentioned mild fatigue, nothing alarming. His doctor ordered a stress test just to be safe. The result? Inconclusive. That was enough to send him to the cath lab. They found a small narrowing, placed a stent, and sent him home. That night, the contrast dye used during the procedure triggered a kidney reaction. He spent 6 days in the hospital. His precaution turned into a crisis. When he finally recovered, we reviewed his records. He had no chest pain, no shortness of breath, and no evidence of heart disease before the test. The stent hadn't extended his life. It had only interrupted it. The truth is, for most people over 70 without clear heart symptoms, a stress test offers little value. It's a solution in search of a problem. A better option? A simple resting EKG to check your rhythm, or a coronary calcium scan, a low radiation test that can reveal whether dangerous plaque is actually building up. These methods are safer, faster, and far less likely to push you into a hospital bed you didn't need. The pattern is becoming clear. One test leads to another, each one promising safety but delivering risk. And now, we reach the next one, the test that nearly every senior is told to take, and almost none are warned about. Number 2, the colonoscopy. It's the gold standard for colon cancer screening. Doctors say it saves lives, and for middle-aged adults, it often does. But after 70, that gold turns to rust. The risks of the procedure start to outweigh the rewards. To understand why, you have to look at what's involved. A colonoscopy isn't just a camera, it's an ordeal. You fast for a day, drink harsh laxatives that flush your system, and arrive at the clinic dehydrated and dizzy. Then comes sedation, something older brains don't handle well. The procedure itself involves inserting a scope several feet into the colon, removing any polyps that look suspicious. In theory, it's preventive. But in practice, the danger grows with every year past 70. The sedation can trigger confusion, even delirium in older adults. The bowel prep can strain kidneys, and the procedure can cause bleeding, tearing, or even heart rhythm changes during sedation. A 2019 JAMA internal medicine study tracked over 1.3 million Medicare patients aged 70 and older. The numbers were shocking. For every 1,000 colonoscopies, only 2 lives were saved. But more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. Still think it's worth it? Let's talk about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in her digestion. Her new doctor, fresh out of residency, suggested a colonoscopy anyway. Better safe than sorry, he said. She agreed. During the procedure, they removed a small polyp. That night, Dana collapsed in her kitchen with severe abdominal pain. The polyp removal had caused a perforation, a tear in her intestine. She spent 9 days in the hospital, lost 10 pounds. Couldn't work for months. When we reviewed her history, she had already had 2 clean colonoscopies in the past. There was absolutely no reason to repeat it. This is what over-testing looks like. Not a miracle of medicine, but a machine that keeps running long after it should stop. The U.S. Preventive Services Task Force now officially recommends ending routine colon cancer screening at 75. After that, the risks rise and the rewards vanish. For those still in good health, there are far safer options. Stool-based tests like the FIT test, which can be done at home, require no prep, no sedation, and still catch most dangerous cases. It's fast, simple, and proven. But here's the danger no one talks about. Once you're in the colonoscopy system, it's hard to get out. Doctors schedule follow-ups automatically, even when they're not necessary. Insurance companies encourage it. Clinics profit from it. The system runs on the illusion that more testing means more safety. But after 70, sometimes less is the real protection. So far, we've exposed 4 tests, each one dressed as prevention, but hiding its own threat. The bone scan that sells fear, the MRI that manufactures anxiety, the stress test that sends you to surgery, and the colonoscopy that can do more harm than good. But all of them pale in comparison to the final one, the most overused, most dangerous, and most misunderstood medical checkup of them all. Because this one might be responsible for up to 5% of all cancer cases in the United States. A scan so advanced, so reassuring, that thousands of seniors pay for it out of pocket every year, not knowing it may be the very thing that shortens their lives. Welcome to number 1 on our list, the full-body CT scan. It's marketed as the ultimate preventive tool. You walk into a private clinic, you're greeted by soft lights, smiling nurses, and sleek posters promising early detection of hidden cancers. The technician says, "We'll scan everything: lungs, liver, kidneys, colon, even your brain." It sounds like peace of mind wrapped in technology, but what you're really buying is radiation. A single full-body CT scan exposes you to between 10 and 20 millisieverts of ionizing radiation, the equivalent of 500 chest X-rays in one sitting. Let that sink in. One scan, the same radiation as 1,000 X-rays, and it doesn't stop there. Because once you take that first scan, odds are you'll be told something was found. Here's the catch. In older adults, especially over 70, the human body is full of harmless irregularities. Tiny cysts, calcifications, benign nodules, perfectly normal signs of aging. But to a scanner, they all look suspicious. One abnormal shadow, one unclear outline, and the machine flags it as potential pathology. That's when panic begins. More scans follow, then biopsies, then surgeries, each one riskier than the last. And for what? A groundbreaking 2023 study in JAMA Internal Medicine revealed something chilling. The surge in CT scan use across the U.S. may now be responsible for up to 5% of all cancer cases. That's 1 out of every 20. Cancers caused not by smoking, not by diet, but by the very machines meant to detect them. Imagine that, a preventive scan that may actually create the disease it's trying to find. That's exactly what happened to Marcus, an 80-year-old martial arts instructor who still trained younger seniors at his community center. Fit, active, sharp. He didn't feel sick, not even close. But when a private clinic offered him an executive health package, he thought, why not? His full-body scan revealed a small 3-millimeter lung nodule, about the size of a grain of rice. The clinic immediately referred him to oncology, panic, PET scans, then a needle biopsy to make sure. The biopsy punctured part of his lung. It collapsed. Marcus was hospitalized for nearly 2 months. The verdict, benign. There was never any cancer. He paid thousands of dollars to find something that didn't exist, and nearly died in the process. He told us later, "That machine stole more from me than cancer ever could have." The truth is, for people over 70, a full-body CT scan offers almost no proven benefit. The American College of Radiology has been clear. There is no scientific evidence that full-body screening in asymptomatic adults improves survival. None. So why do so many clinics still sell it? Because fear sells better than facts. The industry knows that the word early feels safe. But early detection isn't always the same as prevention. Sometimes it's just an invitation into an endless spiral of medicalization. One scan leading to another, one test feeding the next, until a healthy person becomes a lifelong patient. Radiation exposure from repeated scans accumulates. It doesn't fade away like a suntan. Each exposure adds to your lifetime dose, and over years, that cumulative damage can mutate cells, quietly, invisibly. And unlike many other risks, this one comes directly from the test itself. You can't exercise it away. You can't diet it away. The only defense is awareness. Let's pause for a moment. If a test meant to prevent disease can actually cause it, what does that say about modern medicine? It says we've reached a point where too much care can be just as dangerous as not enough. It says the promise of control, of scanning every inch of the body, has crossed into obsession. And it says something else, something hopeful. Because knowledge is power. If you're over 70 and considering a scan, ask questions. Always ask, why do I need this? What happens if it finds something? What's the plan afterward? If the answer is vague, if the doctor says it's just routine, or it can't hurt to check, that's your signal to walk away. Because it can hurt. And sometimes the harm comes dressed as help. A better approach? Listen to your body, not the machines, not the fear. Real prevention doesn't live in a scanner. It lives in how you move, what you eat, how you sleep, and how you think. Exercise, fresh food, deep rest, and emotional connection. These are the checkups that truly add years to life. Remember, medicine is powerful, but it's not perfect. It can save you, or it can scare you into submission. The line between healing and harm is thinner than ever. Marcus once said something that stayed with me. When asked if he'd ever trust another scan, he smiled sadly and said, "I don't need a machine to tell me I'm alive. I just need to feel it." And maybe that's the message we've lost. So here we are. 5 tests every senior should think twice about. The bone scan that feeds fear, the MRI that creates patience, the stress test that leads to surgery, the colonoscopy that risks more than it saves. And finally, the full-body CT scan, the illusion of safety that may be quietly fueling cancer itself. This isn't a call to ignore medicine. It's a call to question it, to balance technology with wisdom, to remember that sometimes less testing means more living. If you're watching this, ask yourself one thing. When was the last time you said no to a medical test? Maybe the real act of courage isn't getting more scans. It's knowing when to stop. And that's how you take back your health, your peace, and your years. Thank you for watching. Share this video with someone you love, because the truth no clinic can tell you might just save a life.